Hi, my name is Adriel William, and today's video is for all the CAAPID candidates who are applying for upcoming cycle. Individuals who are preparing for their advanced standing DDS program and want to apply to American dentist schools. I hope this video will help you because back in 2019, when I started applying, I got accepted to 4 schools and then went through schooling. And over these past years, I made my first video during that time when I got accepted. But over this time, I've been working with candidates. I went to the school and now working as a general dentist. So I would be able to provide you better assistance, better guideline regarding the process that might help you in the coming cycle. So as most of you would know already, in order to start with the process, you need to get your EC evaluation done, which is an organization in US who collects all your documents from your back home, and they evaluate or convert your GPA and tell you what your GPA would be in US. My first suggestion regarding that is don't get locked or don't get over-focused on how much GPA you get, because some countries, their conversion rate of GPA is lower. For example, I have friends who were from Syria, and in Syria, the GPA grading system is not very high. For some reason, all the students don't get very high GPA, and when they go through conversions, their GPA is not very high. It's not super high. But does that stop them from getting into a school in the United States? I would say no, it doesn't stop them. So if you don't have a very high GPA, it's still fine. You will still get into a school because there is a lot of variation. That would be the first advice I'll give you. Second thing about national board exams is that back when I was applying, there was National Board Part 1 and 2 and INBD was just starting in. But one of the most important thing about this exam is that there is no scores, it's just pass and fail. So if you're preparing for this exam, you want to try your best that you study well, you take your time, and you pass it in the first attempt. Because if you pass it in the second or third attempt, it shows in your grading system that you have multiple attempts, and it makes your application less appealing. So if you're preparing for the exam, make sure you take good time. There are resources on Facebook, on YouTube. I gave my exam back years ago, so I do not have the most recent information, but there would be Facebook groups, WhatsApp groups. Join them and take your time to make sure you pass in the first go. That is one of the most important things I would suggest. One thing after that is the Toefl exam. So Toefl exam, from my experience while working with a lot of candidates, that Toefl exam is the bottleneck in the process. That's where people get stuck. They are really good dentists, have a lot of experience, pass the national boards, and then they go in for Toefl and they can't score high. And by high, let me explain what would the highest score look like in a Toefl. So most school, or preferably you should be above 100. But is that good enough? I would say no, because back when I was preparing for Toefl and gave the exam, I scored 113. And I believe if I can do it, so does anybody else, as long as you put in the time and the effort. And it is very important. See, your INBD is just pass and fail. Your Toefl is a score. So the higher score you get, like if you get 118, 117, 119, 115, the higher score you get, the more appealing or more attractive your application would be. So everybody who's applying to school have their pass and national board pass. But now your application has a really good Toefl score, and that makes you stand out. And I'm going to tell you one thing, that Toefl exam becomes difficult for most of us dentists because we are trained in science, biology, we are trained in dentistry and medical line, and all of a sudden now we have to study English. And the honest truth about Toefl is not even an English exam, it's an exam about technique, about strategy. So back when I was applying or I was studying, I went through a lot of YouTube videos, figured out what the strategy is, how to score high in this exam, because you have to be time sensitive. You should be familiar with the format. There's one channel called Noteful, They used to make really good videos. And I made a video about TOEFL as well. I'll share it in the description, so watch it. And prepare yourself with the technique, with the strategies, because it's not about English. It's about knowing what the exam is and how you should be preparing for it. Second thing I'll tell you is that some people think, oh, if I'm not getting 100, I won't be accepted to school. I can tell you that I've known individuals who scored 93 and got accepted to school. And not every country was a British colony, so their education was never in English. For example, I have friends from Cuba, Taiwan, Venezuela who didn't learn dentistry in English, and now they had to relearn dentistry in English and then give TOEFL exam, which was very difficult because they never learned things in English back home. So one of the things that happen is that if you're not scoring too high in TOEFL, that doesn't mean you won't get accepted, because they know certain people from certain countries have this barrier to English language, which is totally fine. So what you do, you take your time, you prepare well, you try to score your hardest, but you try to score the best you can. And you can take a second attempt, third attempt, but try to get the best score that you're capable of. And that would be good enough to apply. But don't stop yourself that I can't apply because I didn't get like 100. But again, as a mentor, as a guide, I would say if you can score 115, 117, the chances of your application being picked by the admission committee will be fairly high. So if you're capable of scoring that high, which I know you would be, go for the highest score that you can aim. Now coming to the third part. So once you're done with all of this, you're going to start working on your CAAPID application. One of the most important thing I tell people is your personal statement. So your personal statement should be coherent to your story. So you're somebody who worked in community work a lot of, or you were in oral surgery, or you were a person of endodontics, or whatever it was you always worked in cosmetic or anything like that. Create a story which is coherent, which kind of talk about your life, like your origin, why you got into dentistry and how you went to a dentist school, what you learned, community work you did, and what's your long-term plan in life. And you should have a common theme in your story. Whatever you talk about in your first paragraph, you should also connect that to the last paragraph. And I have a video on personal statement. You can watch that. But to improve your to improve your application overall, there are certain things you can do. If you're back home in some other country, you can practice more dentistry, try to be a part of an big institution, some teaching hospital, some trust hospital, be involved in a big organization. Or if you're practicing in a private practice, try to take CE courses internationally. So if you're from India, you're from Pakistan, you're from Nepal or Middle East, try to get some courses from Europe, something that you have done, or come to US or take some courses. I know it's expensive, but that shows that you have done something hands-on or taken some courses outside your country, and that shows that you're a person of experience. Next thing you can do, if you come to US and if you do not have a work authorization, try to go and shadow a dentist. If you can do that at a private practice, that's very good. If you can go and shadow a non-profit organization like a community health center, a dental clinic in community, if you can shadow even a hospital, some dental program, some teaching institution, if you can go into big institution and observe and shadow, that's very strong. If you have the money, if you can pay, you can do preceptorship at Boston, at UCLA, at USC. You can go and take some certification, some preceptorship, but they are expensive, so you have to pay money. That's the second option to improve your application or your profile. The third thing, if you have work authorization, if you have legally allowed to work in US, I would say get a hygiene license exam in Florida. As a foreign trained dentist, we can get a license to work as a hygienist in the state of Florida. All you have to do is give exams and give the exam on the typodont. By that, you can earn actually good money, somewhere around $32, 35, 38, depending on your skill set and where you're working. You can actually earn money and improve your application and get more hands-on experience. So that's a good option if you can avail it. The next thing I'll suggest is that if you can't do that, try to do dental assisting wherever you live. Find a job as a dental assistant. You can make some money, not largely, like it's not a king's ransom, but you make a little bit money, but you get a lot of hands-on experience. Take CE courses. Go for hands-on courses like Stevenson's. There's courses on bench exam from University of San Antonio, University of Buffalo, Pittsburgh. Go for these courses. They will really boost your application. If they see that you went for a CE courses at institution, they will really like it. But that's an expensive process, so you need to save money to invest in this. Next thing you can do is also, in some state, there's something called ADA or AFDA. These are auxiliary assistants. These are a little bit above dental assistant because they can place fillings, restoration. So the doctor goes and make the class 1, class 2, or make the cavity. And these assistants, like in Indiana, in Ohio, these assistants can go in and fill that in. So that way you can get more hands-on experience as well. That's also a good way to improve your application. Next thing you can also look into is a master's program. If you can afford the time, that's one of the best ways to improve your CGPA to make your profile stronger. I personally did a master's in health administration from Maryland, and the thing about that is that allows the university to see that this person has gone through the American education and he's familiar with it, or she's familiar with it, and she would be a good student. The only thing is most masters are about 2 years. You have to spend money. And I would prefer, if you can go for a clinical master's, that's stronger. If you can go for a orofacial pain master's, that's a pretty strong one. So something which is clinical, that would be stronger comparatively. Orofacial pain is one you can look into it. One other thing is, if you are extremely fortunate and you are at the right place at the right time in Massachusetts, if you're a green card holder, if you can, if you have work authorization, you can work in a community health center on a limited license. So I've known people. I interviewed one, Dr. Ikra Vora, who worked as a foreign trained dentist in Massachusetts in a healthcare center on a limited license. So you can work as a dentist without going through DDS, and that's a very strong way to improve your overall application. The only problem is very hard to find an opportunity. You need to have good connections. My suggestion would be go in and start working as a dental assistant in a community health center where, if you're in Massachusetts, and make connections and see if they allow you to work on a limited license. The other way you can improve your application is that work or do community work. And most time candidates say, I did volunteer work and I shadowed somebody in a private practice. I would say, if you're going to volunteer, rather than going and volunteering a private practice, volunteer at a community health center, at a mosque or at a church. And don't do it in this way that if I am a Christian, I go and volunteer with a church. I would rather want to go and volunteer in a mosque or a Hindu temple or in some other religious temple, or go work with a HIV clinic. You can work with a domestic violence patient. You can work with patients who are elderly or have PTSD. So go and do something which is out of the box. Don't stay in your own comfort zone. Try to be under the banner of a big organization like Red Cross, like Mission of Mercy. So when you volunteer in these big umbrellas, that make your application look more credible. Because most schools know what Mission of Mercy is, and when you work up there, they kind of see, okay, we know this organization and this person worked in it, which is a good thing. But if you can't even find that, whatever is in your neighborhood, try to work with a non-profit organization. That's a strong way to improve your overall application. Other thing that you can do is try to look for certification. Sometimes institutions are providing radiology certification. So you can do some certifications or some C courses and at a dental school. That is also one of the strong ways to do it. One other smart way is that you can actually find a dental assisting job or some job in a dental school. That way you will be earning money and you will be working in a dental school, and that will allow you to get better exposure of the school, make connections, and learn more. There are other ways as well, but the things I've mentioned until now, you need to understand that. So this is not a place where one shoe fits all. I know every candidate's previous education is different, their circumstances is different, they are at different locations. So this is not like one thing will work for everybody, but wherever you are, whatever your circumstances is, find to make the best situation out of it. One other thing that people could even, I've seen doing, is that they would do preceptorship in a ortho residency, or they will go and you could even find a internship or externship at a oral surgery or a ortho or a endo institution where they have postgrad students. You can go and shadow them and see how they are doing. And most of them charge you, but that's also a good way to make your application strong. One last tip, one thing that can really make your application push, give your application a really strong push, is that if you pass your board exam, you scored good TOEFL score, and now you want to do more, I would suggest reach out to institutions and tell them, email them, not when the admissions start, not when the CAAPID application start, because then everything gets very busy. Do it right now. This is a good time, is that you email schools and tell them that, hi, my name is Adriel William, I did this back home, and after that I've been doing this, I passed my exams, and currently I'm in US and I want to come and visit your institution. I want to learn more about your institution. I want to take a tour, meet your faculty or your current student. Let me know whatever is a convenient time to make this happen. If you do that, if you email like 10 schools and even 3 of them replies you, that's very good, because that way you can make a strong connection. They can know your name beforehand and they can actually conduct a mini interview with you. That makes their life easier, because now you came in, they met you, they saw you, and they are like, okay, this person is already screened. And that increases your chances of getting an invite for an interview. I've known people who would just email the admission coordinator or the program director and say, hi, doctor, I personally wanted to reach out to you because I felt I want to improve my application. Can I get 15 minutes of virtual meeting with you in the next month or whenever convenient for you? And their communication was very straightforward and they were able to get their attention. And the program director did a Zoom interview with them and gave them a feedback of how their application is and how they can improve it. Now, why schools do it? Because in their head, they are doing a mini interview with you beforehand, and then they remember your name. And so when you apply during the CAAPID season, there are like 800 people applying. But out of those 800 people, they already know you. So that increases your chances of getting an invite. So I would keep these things in my mind and when applying. So reach out to schools, communicate more to them. I know there must be some other and more avenues as well, but these are some of the major things I feel you can work on and you can improve your application through them. So I hope this video helps you. And if you have any questions, tell me, reach out to me in the comment box. My WhatsApp and my email address is also in the description. I work with candidates for their interviews on their CAAPID application too. Once in a while, I try my best to work with candidates throughout their whole process, starting from point A, from their person statement till all the way till they get accepted. So if you have any questions, reach out to me. Hopefully, I would love to connect with you, and I wish you all the best. See you in a more meaningful video. Thank you.